Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to go over what to expect post-op instructions for an endometrial thermal ablation. So there's another video on the ablation and also the IUD to treat heavy periods, but if you're watching this video, then presumably you've had the ablation or you're going to, and it's pretty simple recovery. Most women have cramping that evening. I normally do this surgery late morning, early afternoon, and I generally tell patients that most of the cramping will come around dinner time, so I give them a few stronger pain pills, and then after that, usually something like Advil, ibuprofen to take for the cramping that comes the next few days. And generally you should expect to have some bleeding and cramping like a period in some ways, but different, because the lining of the uterus is actually burned, so the blood that will be coming out will be darker, and it might look even charcoal-like, and usually be more days, but not real heavy. It doesn't mean that things didn't work out if you bleed for even a couple of weeks, but we certainly don't want you to bleed to a heavy amount. It's very rare, but some patients can get an infection of the lining of the uterus, have prolonged cramping, fevers, not feel well. So if you're having fevers, you certainly want to watch out for those. Anything above 100.5 degrees Fahrenheit or above 38 Celsius, you should be calling your provider, and you should be having normal bowel habits, urinating okay, able to eat and drink okay. If you're going to have a fever, it can happen on the second or third day more commonly, and we'd certainly want to hear about that if you do. But most women can do most of what they would normally do when they're on their period the following day. I wouldn't recommend going in a bath or shower's fine, but underwater, submerged, pool, lake, jacuzzi for a couple of weeks, especially until the bleeding stopped. And generally, I see patients back in 4 weeks. Your physician might see you back in 2 weeks, they might see in 6, everybody's different. But most women of 5 or 4 weeks tell me their bleeding is much better, a lot less, and they're feeling well. I generally tell patients to give it a full 4 months to know exactly how things are going to work out. I've had patients who have very little bleeding and then after 4 months start spotting a little bit, but still do quite well. I've had other patients who spot a little bit every day, and after about 4 months it disappears. You shouldn't be bleeding to the extent that you did before you had the procedure, but it can take a few months to settle into the pattern. So by 4 months out, if you're not happy with where you're at, that's time to certainly let us know. Also, if you remember, I mentioned that a very small percentage of patients have better periods but more cramping. Some cramping, take some Advil, ibuprofen, other Ponstol, other medications, Midol, see if that helps. But if it's significant cramping, much worse cramping, then you certainly need to be seen and review it with your physician. Sometimes that can be something called post-ablation syndrome, where a little island of tissue is still left, but it has no escape, and so when you have a period, you get some bleeding inside, but it can't get out, and it causes severe cramping. And sometimes the only treatment for that is removing your uterus. Thankfully, that happens in less than 1% of patients. So those are some general guidelines, post-operative instructions. You're going to get a handout. You should. If you don't, from your physician, from your provider, be sure and ask for that. And again, these are general guidelines, informational. You want to know specifically for you if there's any differences, like what medicines you should or should not continue to take that you're already on, things like that. If you're higher risk, have diabetes, high blood pressure, things like that, you want to get specific tailored answers for what you should do different for your course after the procedure. So I hope you found these hints of use, and please leave your comments. Thank you.